I'm going to talk about MRI in imaging post-knee arthroplasty. So this is something that is interesting because there has been such a long time when we kept thinking we can't image patients with implants. And then we realized it is safe. And then we realized it's not only safe, it's extremely useful. Much more useful than other modalities at times. So X-rays are the mainstay in post-arthroplasty, and as we know, the number of knee replacements are increasing every day. We have a large number of patients undergoing them. So obviously, we have a large number of patients who, after an arthroplasty, would come back with some complaints, and we need to image them. One, to find out what's the cause of pain in these people. Second, will this patient require a revision surgery, which is quite a major thing. Somebody who's undergone a surgery, to tell them that you need a surgery again is not an easy task. So do we really need it? X-rays are the primary imaging modality done in everyone. CT is useful to look for osteolysis. There are times when MR, due to the artifacts, osteolysis may not be seen well. CT shows osteolysis better at such times. Also, if there are erosions along the bones, would be seen better with CT. But having said that, MR can still show you the osteolysis. You need to get the sequences and the way you acquire these images right. So we've been doing a large number of arthroplasty imaging. I would say almost about 3 or 4 a week. And the idea is it's possible to get very good images. We take CT cuts in all these patients just because we don't know in whom we may still need it. But believe me, most of the times it's the MR which is providing us all the answers. The very few times that CT has added something to it. X-rays we need to look at before we evaluate what is happening. So the 3 things we look at is how do we get good images, which sequences are useful, and what are we trying to look for in these